Welcome to Prepared for Parenthood, the podcast for hopeful, expectant, and new parents with little ones up to age 5, as well as the professionals who work with them. I'm your host, Dr. Stephanie Dueger, a psychotherapist, author, educator, parent coach, and married mother of 2. On this show, we'll discuss everything from the most up-to-date practicals of best supporting your young children, to thriving in relationship as a family, to more surprising topics around the psychology and development of babies and children from conception through age 5. So sit back, relax, and enjoy. I'm thrilled to have you here today. So there's so much advice out there, things like using nipple protectors for pain or pumping more and trying lactation cookies to increase supply. How should parents think about these kinds of recommendations and what usually actually makes a difference?
Sure. So there's a lot of money to be made for parents and babies. And unfortunately, there's a whole lot of companies that take advantage of the fear that everybody has and thinking I need to have all of this different equipment in order to be able to nurse my baby. And there are things that you really need in order to breastfeed, and those are breasts and feet. Those are pretty much the only equipment that is really necessary to be able to lactate and feed a baby. I won't use the brand name, but the silver or sometimes people have stainless steel discs that they put on the nipple. The belief behind that is that it's going to be antimicrobial and fight any sort of infection that might happen, and that it's going to give protection to a wounded nipple. And when you have wounds on your nipple, oh my goodness, you just don't want anything touching that at all. However, what it does is these are like little cups that just sit over the nipple and they won't stay on unless a bra is over top of it. And so when you do that, it just creates pressure around the nipple areolar complex. So just like if you sat on a toilet for a long period of time and you will have a ring around the rear, it is the same thing around the nipple areolar complex. That pressure that is created when those are on, you'll have a ring. And that ring cuts off circulation, which is the last thing that we want for something that needs to heal. We want to increase circulation to that area. Also, that pressure that is created will cause a lot of people to leak milk. And when they leak milk, it leaks into that cup. And then the nipple is just sitting in that liquid. We have a high water content in our milk because that's the only source of water that our babies get. And that just macerates the tissue. And so it's the same as getting pruning sitting in a period of time. That makes the skin much more friable, easier to tear. It is not what we want to maintain the acid mantle barrier for our skin. So rather than using that, the first thing to do is to correct the latch. Because if we keep hurting the nipple, it doesn't matter what amazing things we put on top of it, it isn't going to get better. When you correct the latch, that is all that is needed in order to have wound healing. And it usually happens within about 3 days. For comfort, things like a good nipple balm and a hydrogel pad over top of it usually works for most people. Sometimes you need a little bit more for wound care, but that's what I would recommend. In terms of the advice that people get that, oh my goodness, I have low milk supply. What I need to do is just do more pumping. I need to do power pumping, or I'm going to follow these algorithms, or I pump on this setting for this number of minutes, and then I turn it off, and then I use this setting, and then I do this next thing. I would say that with all difficulties that people are having with lactation, we need to look for the root cause and to look to nature for our solutions, meaning that babies don't suck with an algorithm. They don't say, I'm going to suck with this level of suction for this number of minutes, and then I'm going to back it off, and I'm going to suck this random number of times, and then I'm going to increase my that's just not how it works. And so the algorithms that are out there for pumping, if that's something that you really enjoy doing, I'm absolutely going to support you in that. But for most people, that's something that's taking up time and causing a lot of stress, and there's really no evidence to say that's going to help you increase your milk supply. Milk removal is important for milk production, but it is not the only piece when it comes to milk production. Sometimes people didn't develop enough glandular tissue in puberty or in pregnancy, and there's no amount of pumping that is going to increase the amount of glandular tissue that you have. Working with a breastfeeding medicine physician can. If you have insulin resistance that is part of the piece, there's no amount of lactation cookies or pumping that is going to affect that. And so I think in terms of people that are working with low milk supply, it is important to work with a qualified IBCLC and sometimes for me in breastfeeding medicine as well, because sometimes we need to do lab work and or use prescription for each individual.
Ana, I've been talking a lot about the feeding aspect, which obviously is very important and it's the main part of breastfeeding, but there's also the connection between the parent and child and the bonding and attachment that happens in there. And that's my field, is the bonding and attachment piece. And I'm just wondering, what is your experience with just sharing the importance of what's actually happening during nursing? There's the feeding and then helping parents understand the importance of connecting with baby.
You are feeding so much more than their gut when you are breastfeeding a baby. You are feeding their relationship, you're feeding their brain, you're feeding their connections with yourself and others. Breastfeeding and chest feeding, in my opinion, you cannot separate out and say it is just blank. When babies are nursing, you're helping to feed their palate. And so that has nothing to do with whether any food from the breast helps to give a good baby. You are also exercising the muscles of their cheeks to prepare them for speech. It doesn't really have anything to do with feeding either. They need to nurse from one side and then the other breast. That's like physical therapy for their neck. That doesn't have anything to do with actually eating. Your breasts can raise and lower their temperature depending on whether baby is too hot or too cold. You're providing a habitat that is just right for the baby. When they are skin to skin with you, they are being colonized with the appropriate bacteria for their skin. That doesn't have anything to do with feeding either. Every time that they come to the breast, they are getting so many needs met. They are getting their need for safety, for security, for warmth. You also have pain relieving substances in your milk. And doing that consistently over time, you won't always get it right for your kiddos. There are going to be times that you guessed wrong what was it in the breast. In the beginning, it's the answer for everything. It doesn't fix who, but pretty much every other problem that babies have, the breast is the answer. And it's because it meets so many needs that babies have. And so, yeah, you are their first connection. They learn to trust that when I have a need, somebody is going to do their best to be able to meet it. And you also learn how to repair in that, because sometimes you're going to guess wrong. I hear parents do it all the time with their babies, that they're like, oh, I'm sorry, I bonked your head when I was trying to get you on. And let me try again. I don't think you can separate out feeding from all of the other amazing things that happen. And it doesn't need to be breastfeeding for that either. People that are bottle feeding are still creating that same kind of relationship with their child, last them a lifetime.
And for those parents who are unable to breastfeed or choose not to, what's your best advice for them in terms of trying to meet all of those needs?
I think that the work for many parents is grief. If something that they wanted to do was to breastfeed and they were not able to do that for a multitude of reasons, that I think is going to be the biggest work for them, is to grieve what they hope and what is. But bonding does not always happen with feeding. Many of the very important people in our lives did not breastfeed us. And yet we are very emotionally attached to them. We trust them. We reach out to them when we need comfort, care, security, when we're experiencing anger, etc. And there's no reason that a parent can't provide all of those things to their baby, no matter how that baby is.
Beautifully said. I have a question. So with my first, a very long time ago when I was nursing her, we just didn't introduce a bottle. And then at 6 months, I had an emergency appendectomy. My appendix burst, and I was in the hospital for the first time ever. And it was a very serious experience. And our daughter had no recourse because I couldn't nurse her while I was in the hospital at that point. And when I could again, it was in between other things that were happening. And so what I learned from that challenging experience, she would not take a bottle. And so we had all these lovely friends who brought over milk, and my husband must have had 20 different kinds of nipples and all these things that we were trying. He was trying to feed her and she would not take it. And she was so upset. We ended up going to my closest friend who was also nursing a baby at that time. And she nursed for my friend, which was amazing and so grateful for that. And what I learned was sometimes things happen that are out of your control, and having options would have been really preferable to that kind of stress that everybody was under. So I'm curious, as a lactation consultant, do you have thoughts about when the best time might be to introduce a bottle if somebody has been breastfeeding? Is there an opportune time to do that? And what's your advice around that?
I have lots of thoughts. So first of all, thank your friend for me, because what an amazing gift that was. And she did what we did before we were an industrialized nation. That was the solution. That is what babies did when their mother's milk wasn't in or mom wasn't producing milk. There were other women in the community that fed your baby. That's just what happened. So not being able to take a bottle is something that is a problem for us culturally. In my opinion, it's because we are not supported as families to be able to take the time that is needed to bring a helpless little creature into the world and get them ready to be weaned, and weaned in so many ways. So yes, bottles are very much necessary for people that need to return back to work and are still lactating and that baby is not ready to be weaned. So when we know that that is the case, then it is important to introduce a bottle around 3 to 4 weeks of age. Babies are still pretty malleable at that time. The older they get, the more opinions and preferences that they have. And you start to bring an older baby a bottle who has been exclusively breastfed, and they're like, listen here, breast only here. I don't know what you're thinking, but that is not going to fly. And they will starve themselves. They will just absolutely refuse to eat. And so that is one recommendation, is to make sure that we introduce it early and then keep up that skill. If babies are going to need to be going to daycare, I like to see them having a bottle a day in order to practice that skill and maintain it so that when it's necessary, it's not a problem. For babies 6 months old, they don't have to have a bottle. They can use cups at that stage. And so it is a learning process, but that's something that can be done for older babies, just to begin with cup skills. And you also bring out another important point of discussion, which is that unfortunately, way too many times people are told by healthcare providers who think that they're acting in the patient's best interest to pump and dump. And they are afraid that whatever medications you've had are not safe for breastfeeding. And in the vast majority of cases, that is simply not true, including anesthesia. Generally, once you are awake and mentating, your milk is completely fine to be able to give your baby. So for parents that might be having similar circumstances, I would recommend Thomas Hale. He has an infant risk center that has a warm line. They're located in Texas, so they have different hours than we do here. But that is an excellent place to be able to call and say, hey, these are all the medications I've had. When is it safe to feed my baby? You can contact any lactation consultant. We'll also have access to that type of information. Katrina Mitchell's website has a Trust to Pump and Dump that is an excellent resource. LactMed is another resource. Lactancia is good for herbs and things that people may not be that familiar with. I would say never throw away your milk, freeze it. Because if we were actually concerned about the amount of drug that was still in your milk, we can always mix that with milk that does not have any medication in it and effectively eliminate that risk. So when in doubt, store it and then get information.
And we will put links to those resources in the show notes for people who are wanting to learn more about that. Ana, any final words of wisdom for our new parents who are embarking on this journey just about breastfeeding or chest feeding or bottle feeding or anything that comes to mind that feels like it would be helpful for people?
I think I would say cut yourself some slack because most of the parents that I see, and I'm no different, I want to be perfect at things, but you just can't. You can't. And you're not meant to be perfect at this because you're raising a human and humans make mistakes and they need to be able to see us make mistakes and see that it wasn't lethal. Yeah, model that. Model that from your kids from the very beginning that you're making mistakes and you know how to repair because I think that's the most important thing in all relations.
Agreed. We've been speaking today with Ana Grantham. She is a lactation consultant with nearly 30 years of nursing experience and advanced training in breastfeeding and lactation medicine. Ana, can you let people know how to find out more about your work, get in touch with you if they have some questions or thoughts?
Sure. The best place to reach me would be through my website, which is lactation.com. You can learn more about me, my services that I offer there, and it's also got a contact me page.
Thank you so much for being here today, Ana. It's been so helpful. You've brought so much amazing information for our listeners. Really appreciate you taking the time today.
You bet.
Take care.
You too.
Thank you so much for listening to the Prepared for Parenthood podcast today. I hope you found this episode educational, informational, and conversational, and that you'll join me again for another episode soon. If you enjoyed listening to today's podcast, I'd very much appreciate if you would rate, review, and subscribe. If you're interested in more information related to today's podcast, or are looking for parent coaching or courses, you can find my information in the show notes or online at preparedforparenthood.com.